Introduction to the new 2019 DHCS Facility Site Review Policy Letter Guidelines. Thank you for listening to this information on the 2019 new California Department of Healthcare Services new Facility Site Review Guidelines. This slide deck is from San Francisco Health Plan FSR team. Medi-Cal managed healthcare plans review primary care provider clinics every 3 years. This overview is intended as a high-level briefing of the changes for both the facility site review and medical record review. In this slide deck, we will cover the background for the changes, the timeline, and key changes. In tandem with this PowerPoint, reading the new guidelines available on sfhp.org website in the FSR section will best help you to comprehend the changes to the FSR process. The last DHCS policy letter update was 2014. Since then, there have been several changes in healthcare. Some of these have been in response to proposals by Governor Gavin Newsom and Medi-Cal's focus on performance. Please refer to the State Auditor's Report for additional details. The content of the DHCS FSR guidelines are derived from federal and state regulations and medical organizations that are nationally accepted, reliable, and promote validated clinical measures. Facility Site Review new policy letter and guidelines will become effective July 1st, 2020. From August 1st, 2019 until June 30th, 2020, the old and new guidelines will be used for any clinic due for a periodic FSR or MRR review. The old guidelines will determine the clinic's scoring outcome. The new guidelines will be used for training and education. The California Immunization Registry is a secure, confidential, statewide computerized immunization information system. You would need to register for this portal on their website. If you have an EHR vendor, please discuss reporting options with them. Site should have a procedure to check expiration date of all drugs, including vaccines. Site should have a procedure in place for confirming correct patient medication and vaccine dosage prior to administration. Vaccine documentation includes the member's name, location given, who administered the vaccine, manufacturer lot number, and registry name. The most recent CDC vaccine information sheet should be noted in the member's medical record. Staff can describe site-specific actions or procedures for handling emergencies. There is written procedure for providing immediate emergent medical care on site. Emergency equipment and medication is available in an accessible location and is ready for use and checked monthly. New emergency medications have been added from the previous requirements. For example, Narcan, chewable aspirin, nitro, albuterol, and glucose tabs or gels. We have a sample dosage chart available for you on our FSR website that includes the updated medications. There are many trainings that your FSR reviewers will need to verify your site review. For example, annual trainings, such as blood-borne pathogens, onboarding or new employee trainings, and any additional trainings as needed. The following slide will show you a proven method for identifying the specific training requirements for each staff member. Staff training is one of the most time-consuming elements of a site review. The FSR team has a staff training tool that can be used to help this process. Whether you have a paper or electronic system, the many training requirements may be in several places and will take time to track down. Let's talk about medical interpretation. The new guidelines have become more stringent to meet the Title VI and Executive Order 13166 requirement for federally conducted and federally assisted programs and activities ensuring meaningful access to limited English proficient persons. There should be documentation of 24-hour access to interpreter services. Your clinic should have clear interpreter policies that assess ability, training, and standards. The medical record should reflect the use or declination of interpreter services. Tip: implementing a standardized process using a standard form for all new patients, such as the one shown on this slide, can achieve reliable compliance in 2 DHCS requirements. 1. Acknowledgement of notice of privacy practices, and 2. Interpreter use for limited English proficient deaf or hard of hearing members. Let's talk about licenses and certifications of your providers. Professional licenses and certifications should be current and in good standing. Additionally, a notice of consumer should be visibly posted with the appropriate font and size in the clinic. There should be postings for both MDs and physician assistants. The last FSR item in this presentation is sterilization. Fewer and fewer clinics are sterilizing in the clinic. For those who still do, please note that requirements are becoming increasingly stringent, and you should take time to carefully read the new guidelines regarding 1. Cold chemical sterilization, 2. Autoclave documentation, and 3. Sterilized packages. Now, as we shift our attention to the medical record review, let's talk about forms. There are essentially 4 member-signed forms that need to be present in each medical record. The first form is a consent for treatment form. The second form is a notice of privacy. The third form is a release of information form. And fourth, for all members 18 years or older, documentation that the AHCD information has been offered or declined. On this slide, there are some helpful tips. 1. Assess current forms being used at your office. Do you have all these forms? How are they being used? Are they found in a consistent area in the paper chart or EHR? And 2. Implement standardized forms and procedures that will ensure every member has each of the required forms in their medical record. Let's talk about persistent medications. DHCS has defined persistent medications for the FSR as ACE inhibitors, angiotensin receptor blockers, digoxin, and diuretics. The goal is to assess adults who received at least 180 treatment days of ambulatory medication therapy for these therapeutic agents during the measurement year, who also received at least 1 therapeutic monitoring event for the therapeutic agent in the measurement year, and at least 1 serum potassium and either a serum creatinine or a blood urea nitrogen therapeutic monitoring test in the measurement year. Let's dive into preventive services. What you'll notice on this slide are specific screenings for pediatric preventive services that coincide with Bright Futures and AAP periodicity practice guidelines. These screening and assessments focus on identifying symptoms and high-risk behaviors in an effort to implement an effective, evidence-based therapeutic intervention. Tip: utilizing a DHCS-approved IHEBA in conjunction with Bright Futures guidelines will help you capture positive responses that require additional interventions using the recommended DHCS screening tools. Now on to adults. Here you will find adult preventive screenings and assessments reflect the USPSTF recommendations. There is increased focus on age and gender appropriate screenings, along with the recommended providers' interventions for positive findings. Tip: utilizing a DHCS-approved IHEBA in conjunction with the USPSTF guidelines will help you capture positive responses that require additional interventions using the DHCS recommended screening tools. I'd like to bring your attention to these specific criteria. Locating evidence on these particular criteria in a patient's medical record might prove challenging. Tips for any female member that is capable of and/or planning pregnancy. 1. It is essential to document the LMP, menarche, and non-fertile status in the medical record. Assess where you might be able to document these items in your medical record system. 2. Document recommendations or declination for supplementation of folate to prevent neural tube defect. 3. Oftentimes, adolescents do not complete questions regarding sexual activity. Ensure either that members have privacy to complete the questionnaire or the provider visibly documents a discussion with the member. And 4. Ensure documentation of counseling on birth control measures and STI prevention if members were found to be at high risk. The new guidelines have 2 focused areas that require several screening tools. Refer to the new guidelines on our website to familiarize yourselves with specific screening tools stemming from the Individual Health Education Behavioral Assessment or preventive screening tools. The next 2 slides summarize some of these changes. The initial health assessment requires screening for any positive answers. For example, if your member answers positive for alcohol, you would implement the appropriate screening tool to further investigate, counsel, and refer as appropriate. In the same manner, for a positive mental health response, you would want to further evaluate with a Patient Health Questionnaire, or PHQ-9. If you have any questions about which screening tools to use, please contact our team to assist you in ensuring that your practice has the appropriate tools per DHCS guidelines. Similarly, every patient healthcare maintenance or well child check requires screening for any positive answers. If a member meets the criteria for any of these categories, the appropriate tool and testing should be utilized. For example, the FRAX tool would be used on a postmenopausal woman under 65 years of age with elevated risk of osteoporosis. If you have any questions about which screening tools to use, please contact our team to assist you in ensuring that your practice has the appropriate tools per DHCS guidelines. The SFHP FSR team has put together a package of information that may help you plan and implement all of the DHCS FSR requirements before July 1st, 2020. Our team is working on creating tools and checklists to help your staff prepare for the on-site review. We are offering support to clinics through one-on-one consultations to help you prepare for these new requirements. We are offering a host of resources available to you 24/7 on sfhp.org in the Facility Site Review section. Here you will be able to find sample policies, protocols, forms, and logs. Thank you for your interest, and please know that our FSR team is committed to supporting and guiding you as we all transition to these new FSR guidelines. Please contact anyone on our team at our new team email, fsr@sfhp.org. Thank you.